The problem with symptom-focused care is that it's not patient-focused. The doctor is often not even focusing on the person in front of them. They're looking at a panel of blood work. They're looking at whatever paperwork they got, and they're making a diagnosis and they're prescribing something before they even hear the whole story.
Welcome to Health Decoded, your number one source for real health information, with your hosts, Dr. Alessi and Matt Tack.
All right, welcome back to episode 2 of the Health Decoded podcast. I'm your host, Dr. Alfred Alessi. Minus my co-host, Matt Tack, today. I'm just running a solo show, and what we're going to talk about today is what we like to call the root cause revolution and why Band-Aid fixes do not work in healthcare and in optimally getting you better, right? If we want to focus on symptom-based care, then Band-Aid fixes are what we do. If we want to talk about health, longevity, and ultimately getting people out of pain and out of disease, they don't work. And this is why we need to get to the root cause. Now, before we get into that, I just want to thank you for joining us. I want to recap kind of what we talked about last week. We talked about our mission and why we're doing this podcast, why we called it Health Decoded. And the whole goal here is to sift through the nonsense, to sift through the noise that is so prevalent in today's society. There's a million people shouting things at you, telling you things, telling you this, telling you that. And we want to just present facts. We want to present ideas that are based on science, based on antidote, and ultimately will work for you. That being said, everybody's biodiversity is different. Everybody has different things that help them, different things that will work for them long term. However, there are very structurally sound methods and protocols that are based on science that can help people. And so our whole goal here is to sift through that, provide you with high-level content and action items that you can take today to get closer to a state of health and well-being. And so if you didn't hear our first episode, go back and listen to episode 1. You'll meet myself and Matt, and you'll be able to hear about what we're doing and all the cool things we have going on within our clinics and just on the show in general. Please go to alessifunctionalhealth.com, sign up for our newsletter. That's how you're going to stay in the know with the show and know when every episode's coming out every Tuesday and what we talked about, and you'll get a little insight as to what's going on. As always, if you find value, please share this with someone, subscribe to the channel so you don't miss anything, and give us feedback. We love reviews. We love honest feedback so that we can know how we can best serve you. We also want to hear from you. We want this to be a patient and driven by you. So a patient-driven podcast where you tell us what you need. You ask us questions. You can send them to ask@alessifxhealth.com, and we'll answer those questions live on the show for you to hear. Now, why does root cause medicine matter? And so let's get into the nuts and bolts here. And the truth is that chronic conditions in this country are on the rise. In fact, about 90% of healthcare costs are driven by chronic disease. That is a staggering number and something that can be drastically reduced through preventative medicine, through focusing on lifestyle, focusing on the things that are making us sick and not just giving out medications willy-nilly for something that can be treated or modified through lifestyle intervention. And so the concept of root cause medicine is really about the specifics. And, so the problem with symptom-focused care is that it's not patient-focused. The doctor is often not even focusing on the person in front of them. They're looking at a panel of blood work. They're looking at whatever paperwork they got, and they're making a diagnosis and they're prescribing something before they even hear the whole story. They rarely ask what you're eating. They rarely ask what you're doing for physical activity. They rarely ask how much sleep you're getting. They rarely ask, how stressed are you? What does your life look like? Do you have 5 kids that are crazy toddlers at home and trying to balance 2 jobs and this and that? They don't ask that kind of stuff. Now, I'm not putting a blanket over every single conventional Western medicine doctor because there are some really good doctors. I'm just saying that this is not the standard and this is not what we're seeing. And so the concept is that it is highly symptom-focused and not patient-focused. And so with a stat like 90% of healthcare costs being driven by chronic disease, we need to do better as a country and as a whole. And so what is the Band-Aid approach? It's basically what I just said. They focus on what are your symptoms and what can I prescribe a medication for? So if you have headaches, what's the best medicine for that? There's basically an algorithm that is taught to doctors that they can take your symptom, plug it into a database, use some of the knowledge they have from school, and say XYZ medicine will help you. What they fail to realize is that there are side effects from these medications that then cause other things. And then what is the symptom for that? And what is the medication for that? And this is where people get stuck in the rabbit hole of Western medicine because it's not specific enough to a person. Everybody's bio-unique. Everybody is bio-individual is a better way to say it. And focusing and taking the time with each patient is now a lost art. And so it's very, very common that I see patients in my clinic who have been through the Western medicine rabbit hole. They've been through the weeds of it all, 5, 6, 7 different doctor's appointments just to come out with hardly any answers and zero solutions, or at least zero solutions for long-term care. It's basically short-term things that doctors then are just saying, here, go ahead and take this, and we'll see you in a few months to see if it works. What we focus on in our clinics is getting to the root cause. And so for the example of something like high blood pressure is a symptom or a sign of something else. It is not the problem. The high blood pressure is coming from something else. Do you have chronic stress? Do you have adrenal fatigue or insufficiency? Are there things going on with the way that your body's fluid dynamics operate with inside? Are you dehydrated, right? Those are root causes that, if addressed, can reverse high blood pressure. Things like chronic pain. Chronic pain is often a diagnosis I hear. Oh, the doc said I have chronic pain. The doctor just gave you a diagnosis of what you told them. You told him you were in pain for the last 5 years. He said you have chronic pain. That's not an answer, in my opinion. That is him repeating back to you. So chronic pain is a sign or a symptom. Now, how do we find out what is the root cause of that? Is there high inflammation within the body? Is there something like rheumatoid arthritis attacking the joints due to an autoimmune condition, maybe caused by some type of gut dysbiosis or hyperintestinal permeability? These are things that we call root cause problems. If your gut is hyperpermeable and it is letting undigested proteins into the bloodstream, the body can confuse these for proteins that make up the joints or proteins that make up your thyroid, and the body can start to attack itself. And this is called autoimmunity. The autoimmune condition is not the root cause. Do you get what I'm saying? I hope this is making sense. And so some of the consequences that we see when we ignore root causes and we focus on symptoms is honestly these hidden costs. The condition tends to get worse over time. People tend to get dependent on medications because the body is smart and the body starts to realize, okay, this works a little bit, but I need more now to get the same effect. I need more now to get the same effect. And so over time, we need to increase doses. We need to try different medications. We need to balance the side effects of one medication with another. And all of this can lead to a reduced quality of life and longevity. And so how does functional medicine take a different approach? Well, exactly the way I just said. We focus on identifying and addressing the root cause of these issues. Now, even something like inflammation, which is a buzzword thrown around, even inflammation is not a root cause. It can be a cause, but inflammation is being caused by something, right? There is some type of dysfunction within the body that is causing chronic inflammation. And we're going to get to this in our next episode about decoding inflammation and what inflammation is. Really, inflammation is your body's response to something, an infection, an injury. It's a good thing, and we should have it. That's how we're alive. That's how we've lasted this long as a society and as a race and a species. However, chronic inflammation is not normal and is something that must be addressed. And so what could be a root cause of something like chronic inflammation? It could be toxicity, an overload of toxins in the body. It could be a dysbiotic gut, that we have too much bad bacteria, not enough good bacteria, causing an imbalance. It could be something like spinal misalignment on nerves that is leading to dysfunction of the nervous system and the communication between those nerves. And so it's really important that we focus on the interconnectedness of our body, how one issue can cascade into another, because we're not just a heart connected to a liver, connected to a gut, connected to a muscle system. We are a whole person, right? And so if you're looking at the whole person, you need to focus on the entire person themselves. And that's what functional medicine does. A really good example of this is a patient that I saw in my office, and she would be cool with me telling this story, so I'm going to tell it. I won't use her name. But she had been to multiple gastric doctors, gastrointestinal doctors, even endocrinologists. She was fed up. She wasn't getting any relief, any results. And they basically said, well, we think you have high stomach acid. Here's this. And they gave her some proton pump inhibitors, which made her feel worse. They said, oh, well, if you feel worse, that's just how it is. She came into my office, referred to me from a friend of mine who's a chiropractor, because we've helped tons of people with gut issues, these kind of problems. It turned out she didn't have high stomach acid. She had low stomach acid due to an imbalance of bacteria in her small intestine. All it took was us to run a stool test to see what the balance of her bacteria looked like. Very simple, non-invasive test. Collect a sample of stool, send it to the lab, and they give you the results. Very specific test, actually. However, none of the other doctors in the conventional medicine thought to do that because it lies outside of the normal protocol that they have. They are also very much run by the insurance company and what they can do. And so if the insurance company doesn't cover it, they don't do it. And so I think that's a massive piece, real quick, to tangent, is that when you want to get better, when you want to improve your health, heal disease, you need to be your own advocate. And the insurance company is not going to do it for you. Even the doctors aren't going to do it for you. I cannot care more about your health than you do. And so on our show and in our clinics, we are proponents of your health is your responsibility. We're here to guide you. You're the hero in the journey. We are the guide, right? We give you the information. We teach you what you can do. Ultimately, you have to do it. We can't go home and eat healthy for you. We can't go home and exercise for you. And so when you can start to make that shift in your life, you will see night and day change in the way that you operate and in your health. And so back to the story, we helped this patient to balance her gut, to remove and detox the bad, to re-inoculate with probiotics and healthy gut bacteria. And then we taught her what foods to avoid and what foods to use, and basically using food as medicine in this situation. 4 months later, she went through this entire protocol, symptom-free. She's back to eating things that she wasn't able to eat before, and she's doing amazing. And she shouts from the rooftops to all her friends what we did for her, because we took the time to sit with her. I spent an hour with her on her first visit, got to know her, got to know what was going on, the frustrations in her story, and I really dug into it. And so I highly recommend, if you're frustrated, you find a doctor like that. You find a doctor who's going to get on the same page as you and be on your level. And if you want to reach out to us, please do. This is what we love to do. And we are not a clinic who wants to keep patients on long term. We want to get you back to health, empower you to take your health into your own hands, and then, like the mother bird, set you free and let you ultimately determine your future. And then if you need us again, we're here to help. So please go to alessifunctionalhealth.com. And if you need, please book a consultation. Happy to get on the phone with you. Happy to have you come in and just hear how we can best serve you. And so ultimately, we also need to start to radicalize a change in traditional healthcare. Start thinking of things differently. Not what can my insurance cover, but what is out there. Because so many people are limited by what their insurance will cover for them that they don't even think outside of the box, and they hold themselves back from ultimately getting to a state of health. And so I want to be here to tell you that it doesn't have to be that way. We can really make a shift together if we start to promote these kind of topics, talk about this stuff, and ultimately educate. And that's what we're here to do. And so please go to alessifunctionalhealth.com, sign up for our newsletter. We release a newsletter every week and often twice a week to keep you updated, keep you informed, keep you in the loop on what we're doing here in the clinics and just in general on the podcast. Please subscribe to the show if you found any value, and stay tuned. We are going to be having some really cool guests coming on the show soon. We're going to be relaunching some older episodes that we've shot that had some really great content to kind of re-inoculate you with what we talked about. And we want to include you in this mission. We want you to be an active participant in what we're doing. So please, I encourage you to send your questions to ask@alessifxhealth.com, and we will answer them live on the show. If you don't want us to shout out your name, that's fine. We'll keep it anonymous, but you will be able to listen and hear your health questions answered. And so what can we do today, right? We talk about action items and what we can do to make a step in the right direction. Well, today, you can start thinking of yourself as a whole, and you can stop thinking of your symptoms. And what you can do is also take a step in the right direction by seeking guidance, seeking help. If you have something that's been plaguing you or holding you back, you've been to doctors, you've been through the gamut of Google and searched and haven't found any answers, look into functional medicine. Find a doctor that you align with. Find a doctor who will listen to you. And ultimately, a doctor who's going to give you the tools to make this change for yourself. And so, again, if we can help, we would love to. alessifunctionalhealth.com. I want to also quickly talk about some of our partnerships. One in particular, a sports nutrition company, Fentik Nutrition. Fentik Nutrition is our flagship sponsor right now, and we have an affiliate code with them. Alessi 15 will get you 15% off. The reason we partnered with them is they have the same mission as us, to empower and to educate. And also, they don't use any artificial anything in their products. They have an amazing pre and intra workout product. They have an awesome protein powder to fill the gaps on where you might be lacking protein. It's plant-based, delicious, and zero artificial sweeteners, artificial colors, or artificial additives. Everything is sourced from the highest level. And the owners, Taylor and his wife, are amazing. They are family people. They're dedicated to their clients, and they always do the right thing. So we just want to shout them out. Please go try them out. If you like using sports nutrition for fueling your workouts or your recovery, Fentik Nutrition, use code Alessi15 to get 15% off. Now, just in summary, we talked about why it's important to move beyond Band-Aid fixes and look at the root cause, because this is how you can set yourself up for success. You can take these things and educate your family. And so I want to encourage you now to take small steps. Start tracking your symptoms. Get a journal. Start tracking your foods in correlation to these symptoms. Every time you eat X, you get Y symptom. Or every time you eat this, you get that. Every time you get shorter amount of sleep, you feel this. Every time you get stressed out or anxious, you feel this. Start writing these things down and look for trends. Look for where you may be having these problems that you are unable to identify before, but now can make a correlation to. So I want to thank you for listening. I want to tell you that our next episode is going to be a great one. We're going to be talking about decoding inflammation and how if you have chronic inflammation leading to chronic pain, leading to any kind of host of diseases, listen up, because that episode is going to be chocked full of information. I want to thank you for being part of our community. Again, if you want more information, sign up for our newsletter and stay tuned. As always, I'm Dr. Alessi. Stay curious, stay empowered, and remember, your health is in your hands.
Thank you for tuning in to Health Decoded, where we break down the truth about all things health and empower you to take charge of your well-being. If you found value in today's episode, please subscribe, leave a review, and share it with someone who needs to hear this. For more resources and personalized support, visit us at alessifunctionalhealth.com and sign up for our newsletter. To hear your questions answered live on the show, send them to ask@alessifxhealth.com. That's ask@alessifxhealth.com. Until next time, stay curious, stay empowered, and remember, your health is in your hands.